Hi there. Welcome to the program, Your Doctor and COVID. I am Dr. Mahendra Carpen, the Head of Medical Services and Cardiology at the Georgetown Public Hospital. And today we will be talking to you about patient experiences that they would have sent in to us on this program. And if you have questions or comments that you would like to share and have your questions answered, please feel free to WhatsApp or message 620-MASK, that's 620-MASK, that's 620-6275, or email at docandcovid@gmail.com. We will be happy to get back to you on the program to answer the questions and take your comments as well. So as usual, I start this off by telling you to continue to wear your mask and make sure when you're wearing the mask it covers both the nose and the mouth, and it is not proper to wear it below the nose, nor is it proper to wear it on the chin. You would be exposing yourself and those around you to potential COVID-19 infection. I will take mine off today as usual because I'm alone recording today and there's no one around me to put me at risk, and I'm not putting anyone else at risk. So here is a scenario that was sent in by a patient. Doctor, I have a cough that's getting worse daily. I have no fever, but I have an itchy throat, a stuffy nose, and coughing that causes pain in my chest and my belly. So that is the scenario that was sent in by a patient seeking advice. So let us look at what are some of the possible symptoms that patients can have that we would recommend COVID-19 testing to find out whether or not this person is actually COVID-19 positive. So for the coronavirus, we look for fever, cough, shortness of breath, symptoms appearing between 2 to 14 days after an exposure, and we will go through what an exposure really is. So that's coronavirus or COVID-19 versus the flu, where again there are lots of common complaints like fever, cough and sore throat, headache, fatigue, body ache, runny or stuffy nose. In patients with allergies, sneezing is a bigger issue, but it can be associated with headaches, especially if the sinuses are blocked up. You could have what is called sinus headaches. These patients may also have itchy, runny or stuffy nose, itchy, red and watery eyes. And the common cold, patients could have cough, sore throat, sneezing, headaches, sore throat, muscle or body aches, runny or stuffy nose and watery eyes. So our patient may be a candidate to test for COVID-19 to see if he is positive, because he has a lot of symptoms which could indicate that he's COVID-19 positive. Now let us look at what in this patient could cause chest pain. In fact, let's look at it generally. And some of the things that can cause chest pain include cardiac causes and non-cardiac cause. So let us talk about pericarditis. Pericarditis is usually an inflammation of the lining around the heart. And this inflammation can cause a significant chest pain that can hurt all the time and can only be and sometimes relieved only with specific position of the patient. So pericarditis is an inflammation around the heart and it can happen. MVP is mitral valve prolapse. If you have a heart valve issue, that can also cause chest pain. The more common one is angina or blockage, which can occur, especially in a Guyanese population. We have to be very vigilant about this possibility. And what do we mean by this? When there's blockage in the arteries of the heart, then not enough blood is flowing to the heart muscle, and blood takes oxygen. So in a shortage of oxygen, the heart muscle starts to become affected, and that's when patient starts to have chest pain. Oftentimes this pain may occur when they exert themselves, or when they try to run, climb stairs, or do some physical activity. The one that we see often as well is heartburn. Oftentimes this represents like peptic ulcer disease or gastric reflux or reflux disease. There's also problems with chest wall that can cause chest pain, as well as lung problem. And we'll look a little bit more in detail about the chest wall causes. But before that, what is it that constitutes a chest pain emergency? When should you consider that, hey, this chest pain is an emergency? Well, when it's associated with choking or difficulty swallowing, when there's cold sweats, nausea or vomiting associated, when it's associated with shortness of breath, when it's associated with fast or irregular heart rate, when it's associated with numbness or discomfort in the arms or shoulders, when the pain spreads from the chest to the neck, the jaw, the arm or shoulders. These are all indicators of severe issues that needs to be addressed medically in the shortest possible time. And so therefore, in the time, even in the time of COVID, one must not ignore heart attack symptoms. And so therefore, this is when you should become concerned if any of these features are associated with your chest pain. Difficulty breathing and discomfort, all of these things, when associated with chest pain, one must not ignore it and stay home. You must seek medical attention to basically determine if this is a serious cardiac issue. Because regardless of the COVID pandemic, nothing else has taken a break. People are still having heart attacks, people are still having strokes, people are still having diabetic complications, and so we must bear that in mind, okay? So the chest pain location can help to determine if this is actually angina or a heart attack. So the typical locations, and in this country, unfortunately, not many things are typical as it relates to heart problems, but the textbooks will describe your location for chest pain. It can be like in the center upper part of the chest. It can be in the same direction if you want to think about wearing a tie, in the same distribution of this tie, straight along the middle of the chest up to the neck. It can also be middle of the chest and shoulder. It can be just in the upper part of the tummy, or the area we call the epigastric area. It can be just a tightness around the base of the neck. It could actually have pain that is going up to the shoulder or down the arm, and rarely chest pain associated with heart attack or angina could be in the center of the back. So one should not take any of these symptoms lightly, especially if it's associated with some of the things that we talked about before: choking or swallowing, cold sweat, shortness of breath, nausea or vomiting, numbness in the hands, irregular or fast heartbeats, and as well as the spread pattern of the chest pain from chest to arm to shoulders to jaw to neck, etc. Those are important things. Now, the COVID-19 patient with chest pain is a very real and a very common thing. So chest pain, as you can see, can happen during the infection with COVID-19, but it can also persist even after and it is the number 4 persistent symptom after fatigue, breathlessness, and joint pain. The 4th most common persistent symptom after COVID-19 is chest pain. And so we have to evaluate all of those features that we talked about to determine if this is a post or an after COVID syndrome, or if it's something more sinister or something that is related to a cardiac issue, which can actually have a lot of mortality and morbidity implications. So we mentioned chest wall as a common reason for chest pain. And so one of the things about chest wall chest pain is this condition that we call costochondritis. And essentially, this is an inflammation at the joint where the ribs meet the breastbone or the sternum. That joint has cartilage or softer tissue, and that can become inflamed, especially in viral infections, or it can also become painful after prolonged coughing or repeated coughing episodes. A lot of patients can have the pain related to that inflamed joint. So the common symptoms of costochondritis include pain in the chest wall and rib cage. This can actually worsen with activity or exercise, and this pain can radiate to the shoulder and the arms, and it can be worse and associated with sneezing, coughing, and in some extreme cases even taking a breath can be painful. So I've often had patients come to my hospital or my practice with chest pain that turned out to be costochondritis, and one of the complaints they have is that, "Doc, I cannot take a deep breath, I can't breathe, I'm feeling breathless." And why does that happen? It happens because when they take a deep breath, it stretches that joint a little bit and it causes excruciating pain. So as a result, to compensate for that, they do what we call splinting. Lots of shallow respiration and faster respiration. So their respiratory rate goes up, but the depth of their breathing goes down. So there's lots of fast but shallow breathing, because to take a deep breath causes a lot of pain. So this is something that one needs to bear in mind. And in this particular patient who would have had severe coughing and prolonged coughing for their complaint, this may be a potential cause for the pain, because it's causing pain in the chest as well as the belly. But nevertheless, this patient should consider having a COVID test to find out if this is actually related, because the coughing may be due to COVID, and then that coughing and the associated infections can cause the costochondritis or some other reason for chest pain. So the other concern that people have been having is what's their actual risk level as we now start to reintegrate into society and people are becoming more interactive. So who are the actual high-risk patients? So if you have close contact in a household with someone with a confirmed case of COVID-19, you are considered high risk. You are medium risk if you had sustained close contact, that's 10 minutes or longer, within 6 feet of a person who has the symptoms of COVID-19. You are considered low risk if you are in the same room as a symptomatic person who tests positive for COVID-19, but you didn't go within 6 feet of them. And I should add here, if you were wearing your mask. Patients who have almost no risk is if you are walking by or briefly you're in a room with a symptomatic person who tested positive. So I hope this clarifies a couple of the questions and doubts that we may have had. And remember to send us your questions at 620-MASK, that's 620-6275, or send an email to docandcovid@gmail.com. Thank you very much.